The Crisis Response Plan, or CRP, is a brief procedure used to reduce an individual's risk for suicide. The CRP is created collaboratively between a suicidal individual and a trained individual, and is typically handwritten on an index card for easy, convenient access during times of need. The CRP serves as a checklist to follow during periods of intense emotional distress. At its core, the CRP helps someone remember what to do when they feel emotionally overwhelmed. The CRP is comprised of 5 key sections. 1. Personal warning signs. These are personal indicators of an emerging emotional crisis and help the individual to know when they are heading towards a crisis. 2. Self-management strategies. These are simple strategies that can be used to help reduce stress or serve as a distraction during times of intense crisis. 3. Reasons for living. These are things that provide a sense of purpose or meaning in life. 4. Social support. These are people who provide support or elevate one's mood during tough times, such as friends and family members. 5. Professional crisis support. This includes contact information for healthcare providers, crisis hotlines, and emergency services. The CRP usually takes less than 30 minutes to create. An important part of the CRP is helping individuals to successfully cope with intense levels of distress when faced with problems that seem unsolvable or never-ending. Here's an example of a CRP that was developed with a young male who was referred for outpatient treatment by friends and family members after a close call with suicide. We will call him John. During an argument over the phone with his spouse, John grabbed a shotgun from the storage shed with the intent to shoot himself, but ultimately he decided not to. When he was not admitted to the inpatient psychiatric unit, John was escorted to our clinic to initiate outpatient treatment. The CRP was developed during the first appointment. John identified 3 key warning signs: pacing, feeling irritable, and thinking it'll never get better. Note that these warning signs include a behavior, an emotion, and a thought. John then identified 3 strategies that had previously proven to be helpful for reducing stress or feeling less overwhelmed: going for walks, watching episodes of a favorite TV show, and playing with his dog. Playing with his dog also serves as a reason for living for John. Indeed, John said that on the day of his near attempt, it was seeing his dog's face and wagging tail that helped him to snap out of his state of mind. John also identified his family as a reason for living and recounted 2 specific memories that were especially positive: a family vacation and a holiday celebration. In terms of social support, John identified 2 sources: his wife and his mother. John next added his therapist's phone number, along with a reminder to leave a voice message in the event his therapist was not able to answer the phone. Finally, John was given the phone number for the National Suicide Lifeline, and as a final step in emergency situations, was encouraged to go to a hospital or call 911. Despite its brevity and simplicity, the CRP is remarkably effective. In a 2017 study published in the Journal of Affective Disorders, researchers reported the results of a study with 97 individuals who walked into a clinic or emergency department during a crisis. These individuals were randomly assigned to receive a CRP or a different strategy that is commonly used by many healthcare providers, a contract for safety. This study showed that during the next 6 months, individuals who received a crisis response plan were 76% less likely to make a suicide attempt. Only 5% of those with the CRP attempted suicide, as compared to 19% of those who received the alternative, more common intervention. Additional research is currently underway to further improve the CRP and to understand how and why it works.